Hi everyone. I want to give you a brief just overview why we use olive oil and fish oil in the protocol to lower inflammation. And the olive oil in particular goes back, in the 70s and early 80s. There was a epidemic of diabetes and obesity in India. Here we had a cardiovascular epidemic, kind of it was at least talked about that way. And people are wondering, why are we seeing these problems? Now we know both cardiovascular disease, meaning strokes, heart attacks, and diabetes are both triggered by inflammation, okay? And so we're trying to figure that out. And then there was, this observation that, like the Italians aren't getting sick like us. People in the Mediterranean didn't have the same increases in heart disease and diabetes. And so it was this focus on the Mediterranean diet. And so it became clear, especially when you looked at India, what was going on was, for centuries in India, they've used different regional oils: coconut, rapeseed, sesame seed, mustard seed. I'm sure many others I haven't heard of. And in particular, they aren't inflammatory. They aren't harmful. And in the United States, we were using butter or old-fashioned lard for the most part. And then later of last century, as the food supply started becoming industrialized, there was the introduction of soybean oil, which was much cheaper. And people started switching over. Soybean oil, corn oil, vegetable oils. I mean, this also includes safflower, sunflower oil, all right? And these are highly, highly inflammatory. Now, they discovered then the reason why the Italians weren't getting sick like everybody, because they were exposed to these oils too. When they would buy food in the market, the industrial food was containing soy oil, and restaurateurs were probably starting to use it too when you went out to dinner. Was that the olive oil will protect you from this stuff. And as an example, you take a little mouse study and you healthy diet, you sprinkle a little bit of olive oil in there. So it's proportionate to what, say, an American might get. In only 6 weeks, they get inflammation in their brain, they start developing diabetes, and they start becoming obese. In just 6 weeks. Now, you leave them on that food, okay? You add olive oil, and in 2 more months, the inflammation in the brain goes away, the blood sugars normalize, and the obesity goes away, and they're still getting the soy oil. But the olive oil that's in there, in addition, protects them. So that's why we use it. It also is because you can't hide from this stuff. And especially when livestock, so meat and chicken and farm-raised fish, pork, when you feed them corn and soybeans, you're getting these oils and constituents of these oils concentrating in the meat. And they cause the same inflammatory damage in the mouse, all right? So it's really almost impossible to hide from this stuff. So you need the olive oil every day. And because of this and other factors, they put it in the food pyramid in like 2004 or something like that. I mean, a good while ago. And it says that all adults should have 2 tablespoons a day, 30 ml. Okay? So that's why we have the olive oil. And fish oil contains, as most people are familiar with, omega-3 fatty acids. And what do omega-3 fatty acids do? They are the molecules your body needs to turn off inflammation. They're part of the off switch. And we don't get enough in our food supply. So these oils contain too much of the on switch, so olive oil will protect you from, like soybean oil. And then the omega-3s are just part of the off switch. So we're just helping to get your inflammatory switch to work better instead of just being stuck in the on position. That's it. Pretty simple. Very cheap. Very safe. So hope that helps you all. It's critical part of all of this. So everybody have a good day.